Hi guys, it's Dr. Brooke Kolesiak here of Legacy Physical Therapy. So last week I had the chance to talk to everyone about pelvic organ prolapse, what it is, what the symptoms are, what are potential causes, and how some things you can do to prevent it. And at the end I said that this week I'd be following up with what are some treatment options for pelvic organ prolapse. So that's what we're going to be talking about today. Seeking medical help for pelvic organ prolapse does not mean that you're committing to having surgery. Okay, there are many women can benefit from conservative treatment options like physical therapy to help with the prolapse symptoms, and maybe only need to go on to surgery if those symptoms for prolapse don't get under control with the conservative treatment options. So a lot of treatment options for prolapse depend on what your individual problem is and the symptoms that you are experiencing. Okay, so treatment for prolapse should be there to help you improve your quality of life and get you back to doing activities that you want to be doing. And so the type of treatment option should be geared appropriately for that. So with most prolapse, pelvic organ prolapse, you have several conservative or non-surgical treatment options. So one option is honestly to watch for now, not do anything. Okay, so maybe you've been told that you have a prolapse by your gynecologist, but honestly you don't have any symptoms that are bothering you. So you can have an asymptomatic prolapse. Okay, not all prolapses require invasive treatments. Okay, the goal of the treatment should be to improve quality of life. So if the prolapse isn't causing you any discomfort or interfering with things that you enjoy, your doctor may suggest that you hold off on treatment for now. A caveat to that is that it still would be a good idea to potentially work with a pelvic physical therapist for a visit or two to make sure that your musculoskeletal system, so your abdominal muscles, your pelvic floor muscles, all those the supporting muscles around your pelvis are doing what they need to be doing so that we can prevent any worsening of symptoms or symptoms from starting while you continue to be active and symptom free. So making sure that our body and our muscles are working the way that they're supposed to be working so that you don't start to develop symptoms in the future, because a lot of times our body is great at compensating for things for a long time, but then eventually the tissues can't compensate anymore and we end up having an issue. So a pelvic physical therapist can definitely help to mitigate that and make sure that you are using everything to the best of your ability to keep everything healthy and symptom free for the future. So that's option number one, is kind of wait and watch and see. Don't necessarily have to do anything if you're not experiencing any symptoms. Other options include lifestyle and behavior changes, and we talked a little bit about this in prevention, that losing some weight can definitely, if you're overweight, can take some of the pressure off of the pelvic area and pressure off of the prolapse. Adjusting your physical activity so that we're not pounding or putting as much stress down through the pelvis. Now, I always want women to be as active as they can be comfortably, but sometimes we do have to adjust what they're doing exercise-wise or how they're doing the exercise to make sure that it is still appropriate and not putting too much pressure down through the pelvic area. And that's, again, where partnering with a pelvic physical therapist could be very helpful to make sure that's you're making the appropriate adjustments. If you are a smoker, stopping smoking is of the utmost importance, because the tissue damage done by smoking, as well as oftentimes the chronic cough that goes along with it, puts a lot of extra strain through the pelvic area. And another lifestyle or behavioral changes to make sure that you manage constipation, and so that hopefully you are not experiencing bouts of constipation where you're having to strain real hard to have a bowel movement, because that, again, will put more pressure down. So those are 4 different kind of lifestyle and behavior changes that you can do. A third thing that you can do is potentially get fitted for a vaginal device called a pessary. So a pessary is a support for the vaginal canal that helps to keep the prolapse up and in where it should be. I think of it as like an ankle brace, but for the vagina. And so I've been told by many a patient who is younger, maybe in their childbearing years, and dealing with a prolapse, but is not an appropriate surgical candidate because they're going to have more children, that they've heard about a pessary, but when they brought it up to their doctor has said that a pessary is just for little old ladies who can't have surgery, and they're not appropriate for someone young and healthy like you. And I would have to respectfully disagree. A pessary to me is just is a nice conservative option that gives women support to the tissue so that they continue to be active and comfortable the way that they want to be. Okay, to me, it's like me having an eye issue and needing to wear contacts or glasses. You know, no one's going to tell me that glasses are just for little old ladies. Okay, if I have an eye issue, they're going to recommend glasses for me, and that's going to support my eye function so that I can see and do things to the best of my ability. And so that's where pessary can be helpful as far as a conservative option for someone who's potentially not at a point where they can have surgery or does not want to explore surgical options for it. A pessary, I've recommended that numerous times for women to be able to be active running or working out the way that they want to be, or simply being able to take care of the kids the way that they want to be without having extra pressure or having support issues through the pelvis as they're doing their day-to-day activities. So a vaginal pessary can be very helpful. There are many different types of them, and quite honestly, you need to get fitted for one that's going to work well for you. I recommend that if you're dealing with the pelvic organ prolapse, is to talk about this with your gynecologist, and more specifically, there is a specialty type of gynecologist called a urogynecologist that really focuses on treating pelvic organ prolapse, and they would be your best option to work with. And so partnering up with a urogynecologist to talk about your prolapse symptoms and potential use of a pessary would be a great idea. The last topic or type of treatment that I'm going to bring up as far as conservative options is pelvic physical therapy. So this is what I do day in, day out, and I work with many women who are dealing with different types of pelvic organ prolapse, and oftentimes we can get them symptom-free without any type of surgery or medication, simply by modifying activity and strengthening their support muscles and teaching them new ways to move so that they're not putting too much pressure down through the pelvic area. So I highly, highly recommend partnering up with a pelvic physical therapist to make sure that you are addressing all of the potential muscle support components involved in a pelvic organ prolapse. So those are all different conservative treatment options, and I would highly recommend exploring the conservative treatment options before jumping into a surgical repair. And that in some cases, depending on the severity of your symptoms and your general health and what's going on, pelvic organ prolapse surgery may be recommended. And in that case, I would definitely partner up with a gynecologist to explore that option, because they would be the most appropriate person to consider that type of treatment plan.